Hi, everyone. We're really excited about this webinar. If I can invite my co-host Tracy, Sneha, and colleagues to come on. As you're joining, please do share with everyone in the chat who you are, where you're calling from, what your interest is. We'd love everyone to be introduced. Please make sure you select everyone and not just hosts and panelists. And we'll begin in a minute as people are joining. Wonderful. Hi, Warren. Great. And Tracy, I'll hand it over to you to kick us off maybe in a minute while we just give people a chance to join.
Okay. I think we'll now go ahead and start. We have over 120 who have joined us. So good morning, good afternoon, good evening, everyone. We are delighted to welcome you to today's webinar titled The Models of Childcare Provision in the Global South. This webinar is co-hosted by WIGO, which is Women in Informal Employment, Globalizing and Organizing, and ECDAN, that is Early Childhood Development and Action Network, sorry. Unfortunately, interpretation is not available today, and the meeting will be conducted only in English and recorded. The link will be shared with all those who have registered. If you have any questions, if you have any concern, please type them in the chat. But if there are questions, you can use the chat box. To introduce myself, my name is Tracy Koske. I'm the childcare coordinator at WIGO, and I'm thrilled to have you all here as we explore the critical role of childcare in informal work settings and learn how different models are addressing this need. Please take a moment, as Shekufe has mentioned, introduce yourself in the chat and let us know where you're joining from. On the 29th of October this year, we are honored to celebrate the second International Day of Care and Support, a reminder of the profound impact that quality care has on families, communities, and economies around the world. This day underscores the importance of caregiving services for both formal and informal, and highlights the need for better policies, protections, and resources for caregivers and those who receive care. WIGO joined the Global Trade Union Federation, along with the International Domestic Workers Federation back in 2019, to start celebrating care workers and elevating the quality services of all workers. Today, we are also launching our Childcare in Markets ebook. A link will be shared later in the chat, which tells a story of how informal workers in South Africa, Ghana, and Rwanda are informing, developing, and implementing childcare policy, and running ECD centers in and around marketplaces in order to reduce the burden on women street vendors and market traders. Many of these women workers in the informal economy face the tough reality of caring for the young children at their market stalls due to the lack of childcare services near homes and their workplaces. Dr. John Lombardi, in her reflection of the ebook, said, Childcare in markets brings to light an often overlooked need for women who work every day, bringing necessary goods and services to families around the world. This report is an important reminder that we all must support their children and their ability to care for them. It also demonstrates that innovation in childcare is very possible and investments are needed to bring them to scale. We would also like to share that WIGO and UN Women are conducting a research to co-create a set of resources which could serve as a reference point for the global childcare community and national governments to guide the design and implementation of childcare services, policy outcomes, and effective use of limited resources that usually cater to the rights and the needs of children, working parents, and their care and childcare workers. We have a fantastic lineup of speakers, including our moderator for the day, Silke Staab, Shekufe from ECDAN, Susan Thomas from SEWA, Dr. Evans George Owino from AFCAN, and Sneha, who is my colleague at WIGO. Each speaker will share unique perspectives and insight into sustainable childcare models and systems across the global South. Now, if you allow me, it's my pleasure to introduce our moderator, Silke Staab, a research specialist at UN Women, New York office, a co-author of several of the organization flagship reports, and has published widely on gender, social protection, and childcare policies. Please welcome Silke.
Thank you, Tracy, and welcome everyone. It is such a pleasure to be here today and to share this webinar with the amazing experts that Tracy has already partly introduced, and with at the moment 100 and going on 160 participants from all over the world. So I'm really happy to see how much this issue resonates. And I think we've seen that happening over the past few years, right? Especially since the COVID pandemic, that childcare has really emerged as an issue of growing public concern, including in kind of the global development community. And there's heightened awareness really of how critical childcare services are. Despite this recognition and growing awareness, there is still, we think, a significant gap in our understanding of which models of provision really work best for different groups. And so I think this, particularly in the global South, I will say, I think there is longstanding research on high-income countries that points to important lessons, but that may not necessarily be applicable to the varying contexts in the global South, in particular the reality of informal workers, as Tracy already mentioned. So we have a diverse array of childcare models out there existing, from cooperatives to home-based care, family daycare, private for-profit centers, public provision, cooperatives, employer-run and employer-supported centers, and so on. And I think what brings us all together here today is really the concern to know more and to move towards models of childcare provision that contribute to the realization of children's rights, that contribute to their well-being, but that are also attuned to the needs of working parents and respect and protect the rights of the workers who provide the childcare services. At UN Women, this has been an issue close to our hearts for a very long time, and we're very excited to be part of that research project with WIGO that will look more deeply into those different models of provision, and really happy to be here today to delve deeper into some of the actually existing experiences. So we'll be hearing from different childcare experts covering different contexts, approaches, and tools that really will provide us with important insights as to how different childcare models work in practice, how they work to meet the diverse needs of children, parents, and caregivers. What are some of the emerging best practices, but also some of the implementation challenges that we see and strategies to address them. So without further ado, we will have 4 presentations by our childcare experts. Each of you will have 10 minutes. I will go off screen when you start to present so that the audience can see you and your presentations, for those of you who will share screens. And I will come back on camera when you have 1 minute left of your 10 minutes. I'll be fairly strict with time so that we have time for questions and answers after the presentations. So let me introduce our first speaker, Shekofe Tsonji. Shekofe is the Global Technical Lead at ECDAN and spearheads key knowledge, learning, and strategic partnership initiatives for the network. Shekofe will be presenting to us, sharing with us a childcare systems map that she has led on developing, and that's a tool really designed to uncover critical leverage points within the childcare system. So Shekofe, over to you. You have 10 minutes, and I will introduce the other speakers as we move on in the program.
Thank you so much, Silke and Diego, for this great opportunity. So today I'm really excited to be the first speaker of the series because I think the question is not just about which model, but how do we decide that? And this has been the process of the last 1.5 years with an incredible systems childcare working group that we've been collaboratively working on over the last year. And I think this is an important question for a few reasons. I'm not going to go through why childcare is important because we all know that, but we know that childcare benefits across we have benefits across children for a whole range of reasons, especially quality childcare around brain development, social development, literacy, numeracy, etc. We know about parents and caregivers, especially women, in terms of increased agency, increased access to the workforce, and a whole range of reasons around there. And we also know that there are wider society benefits. And yet we're still in the situation where we need to talk about how do we advocate for expanding equitable childcare. And the reason for that is multifold. One is that we are dealing with a very complex operational environment. This slide is intentionally meant to overwhelm all of us, because we need to think about all the different types of models, all the different service design considerations, how many hours, quality of childcare, workforce training, et cetera, all the different policy laws, regulatory frameworks, the different populations that we need to access, whether urban, rural, remote, informal workers, et cetera, and the list goes on. So how do we possibly wrap our hands around all of this complexity, especially when childcare is driven by so many different sectors: education, gender equity, feminist groups, early childhood development, labor and worker rights, health and nutrition, and the list goes on. So this is the reason, but what happens is when we don't address this complexity, when we don't sit with the difficultiness of how complex all of this is, we end up working in silos, and as a result, there are unintended consequences to the decisions we make that drive our advocacy, policy, design, and implementation. Either our decisions are driving only market solutions, or for example, when you have just paternity leave, but we don't address the mindset and the culture of what men do when they get that paternity leave, which increases the burden on women, or if we drive childcare without thinking about quality early childhood development inputs, we have poor child development outcomes, and so on. So the real importance of making sure we look at the complexity as we're asking the very important questions that Silke just shared with us in framing our discussion. So this is where we said that, okay, we need to take a different approach. So we've been engaging a lot with the systems thinking world, which is a massive community that engages across sectors. And what we mean by systems thinking is that it's the ability to see the synergy of the whole rather than just the separate elements of a system. So usually we like to keep things simple with policymakers. We need to have one message. What's the one ask? But we need to also collectively as a community engage with the whole of the system so that we are sure that that one ask is the right ask as well. So it's my pleasure to present. This is not something I developed personally. This is on behalf of an entire group. We had the leading scale organizations that implement childcare systems in Asia and Africa working over the last 2 years that have been working with us. And so BRAC, a Foundation for Continuing Learning, Mobile Creches, One Sky, Smart Start, and I see Rebecca in the audience. Please jump in, Spark Health, Nurture First, and so on. And this has been an intensive process. We've had in-person workshops, we've had tremendous consultations, both at the Africa Regional Conference and the Early Childhood Regional Conference, a lot of engagement work, a literature review, a lot of participatory approach to this work. And so this is the map. So over the next 5 or 6 minutes, I'm going to kind of give you an overview of the map, just so that you can understand why we took this approach as a way to frame it. And we haven't launched the map yet. So this is a sneak preview into the map itself. So I'm just going to quickly press play here. All right. So as I shared, that this was the first childcare systems map we know, which showcases the predominant dynamics that are driving the behavior of the childcare system in low and middle income countries around the world. The main question that has been driving that this map aims to answer is what factors influence the provision of equitable and developmentally appropriate childcare services for children, their families, and caregivers. But before we dive deep into the map, I think it's really important to understand that this map, it tracks relationships between different elements of the system. So it's not just about different factors, but what is the relationship between them? These relationships form different stories and feedback mechanisms in the systems, which we present with these types of feedback loops in the map. So I won't go into in much depth, but just so that you have a general bit of an overview. So this is our childcare systems map. At the center of it, in the big red feedback loop, you see the deep structure. This is the deep structure. It's a broad summary to the main framing question. From this deep structure, you have 4 different regions. You have policy and resources in purple, gender equality in green, social and economic development in blue, and family and community in yellow. The deep structure provides a core story, and it's the center around which the entire map is structured. It explores how in many low and middle income countries, competing priorities as well as the lack of political leadership can lead to early childhood development not being meaningfully considered as a political priority or a universal right. This often results in contextually inappropriate policies as well as significant lack of resources allocated to childcare. As a consequence, a lot of the childcare services end up occurring outside of the regulatory nets. Such informal childcare services can fill some of the gaps in provision and quality, but also make childcare even less visible and urgent to address by governments. The current challenges with providing equitable access to quality childcare do not only impact children's development and the lifelong outcomes, but also contribute to lower participation of women in the workforce. In addition, it is observed that across cultures, strong belief systems still upheld the idea that childcare should be a woman's responsibility. Layered with a wider range of gender disparities, such beliefs lead to a general underappreciation of care work. So this is the core story of childcare in many contexts. Maybe the details might be different. But when we begin to move into other regions of the map, we first look at the policies and resources region in purple to the right of the map, where we explore how multiple dynamics are contributing to childcare not being considered as a meaningful political priority. This leads to challenges in developing contextually appropriate policies and allocating resources towards ensuring quality childcare. It often translates into challenges in coordination, minimal or no training for care workers, limited infrastructure, and the lack of appropriate state quality control, which negatively impacts the quality of childcare provision. The gap left by the state is often filled by a variety of market-based solutions. Many of those are small, home-based childcare models supporting women entrepreneurship, while others are bigger centers and chains who can sometimes be more profit-driven, therefore impacting negatively on the quality of care. So the gender equality region in green, which we're coming to next, it explores how, in many places around the world, gender disparities and patriarchal structures define childcare as a woman's responsibility and in general as a less valued and rewarded job. This is still one of the most significant barriers for women to work. Yet, as the number of women entering the workforce is on the rise, there's a growing demand for affordable childcare services. And this is being met by the emergence and expansion of diverse childcare models, which we'll be hearing from today. When it comes to social and economic development, the region in blue, it is observed that in low and middle income countries, the lack of decent work opportunities for a significant part of the population negatively impacts the equity and quality of the childcare. Internal migration, social inequality, overburden of childcare services are often some of the dynamics highlighted in the systems map, which affect the equitable access to quality childcare. The consequences are unfortunately for the children, their development, and the burden on the education systems in later years. The region on family and community in yellow explores how limited access to quality childcare reinforces the belief that childcare should occur within the family and usually leads to communities organically self-organizing around childcare, accounting for a predominance of family and community-based childcare in the countries of focus. So with that whirlwind summary of the whole map, what I'm hoping that we can do with this map, because we haven't begun, we hope that the childcare system map can be used to zoom out and understand the predominant dynamics which are influencing the current behavior of the system, to structure and analyze some of the entrenched issues in the system, clearly communicate the complexity of the system and its behaviors to diverse stakeholders, identify leverage points in the system where small changes can lead to significant improvements, design an investment funding portfolio, train and educate colleagues in the systems thinking of the context. So with that, I'm hoping, we'll share the link to the map. What I do want to say as I wrap up the presentation is that this is a high level map because it was across many contexts. So we actually have developed country adaptation guidance where we hope that countries will adapt it. With each of the sections of the map, you can actually put evidence and links to the resources. And we've had incredible experiences where when you print the map in large and you have groups of stakeholders come around it, suddenly you're starting to look at the system and where you belong in the system and how you can impact. And we always think our advocacy goals should be policy, but when you start looking at systems dynamics, you realize that maybe policy isn't always the best target of our advocacy. Maybe there are other leverage points in the system that we can target that will have greater impact as well. So with that, Silke, I hand it back to you. Just a brief overview summary of the Childcare Systems Working Group's work over the past year.
Thank you so much, Shekofe. I think this was an excellent presentation, not only in terms of the map that you presented, but also I'm glad that you went over the process by which the map was put together and really how important it is to build those bridges and generate consensus across different sectors and across different stakeholders. And I think one of the really important things you raised is that when childcare is not a political priority, it's not that childcare doesn't take place anymore, right? It still continues to take place. It's just less visible, less regulated, more precarious in many ways. And it also made me think that, oftentimes it's being said it's too expensive to fund quality childcare services. But the fact that it's not funded also doesn't mean that it doesn't have a cost, right? It's just that the cost is being shifted to families and to workers that may not have full access to even basic labor rights and social protection for the childcare work that they do. So thanks very much for sharing this experience. We'll move on to the next speaker. And may I just say, I saw in the chat that there have been several requests for please talking a bit more slowly. I'm probably guilty of talking too fast as well. So just a reminder to the upcoming panelists to bear in mind, particularly since we don't have translation. So next up, we have Susan Thomas, which is a real pleasure to introduce you. Susan is the National Health Coordinator. She's working very closely with the Self-Employed Women's Association in 9 states of India. She also manages the Sewa Childcare Initiative and is actively involved in Sewa's health cooperative. And Susan will be sharing with us the really important models that Sewa has spearheaded to meet the needs of their constituency of women in informal employment. So over to you, Susan. You have 10 minutes.
Thank you, Silke. Hello, everyone. I'm going to talk about Seva. So let me begin with our journey. So ours is a journey that began 40 years back. It was in the 80s when informal women workers, our members, wanted a safe space to keep their young ones when they were working. A space they could trust, a place that is safe and they could work with peace of mind. They came to Seva and Seva helped them organize their own membership-based organization, the Childcare Cooperative, which was registered in 1986 and the first of its kind, with over 600 shareholders today. This was the beginning of Seva's cooperative model of childcare, which serves 300 to 350 children between few months to 6 years old. Each center is run by 2 trained creche workers, informal workers themselves, who are also shareholders of the cooperative and from the same community. The mothers of the children are also shareholders of the cooperative and members of the Seva Union. Parents contribute a nominal fee, which covers a third of the total cost of the child per month. And the creche workers look after the children with utmost care and affection, provide hot meals and early childhood care and education to the children. The board of the cooperative are elected from amongst the creche workers and the mothers who manage the cooperative and are the decision makers, and they meet every month. The uniqueness about the cooperative model since 40 years has been they run full day to help the mothers work. We maintain quality standards. It's accessible to the informal workers close to their workplace or their homes. It's affordable and participatory because it's as a cooperative, as shareholders, they participate in the governance, in the decision making, and in the day-to-day running of the centers. Our experience of 40 years has also enabled us to explore different models. The ICDS, the Government of India's program, one of the largest ECD programs in the world perhaps, reaches out to vulnerable and disadvantaged communities through 1.4 million centers. So we provide education and awareness to our members, particularly on the emphasis on the first 1,000 days to access these services that the ICDS is providing. And our community leaders, the local women leaders, they mobilize the informal workers to actively participate in the monthly immunization and checkups for pregnant women, ensure proper nutrition by using the take-home packets and supplementary nutrition and other services. We are particularly focusing on the centers in the tribal and remote areas. Tribal areas are the people where indigenous communities live. Our community leaders are able to ensure maximum mothers take advantage of the services by sending their children to these centers while they go to work. It is important for our members in rural and tribal communities to access these services. And we are working in several states and several districts with this program. These families often struggle to find time and do not have the exposure to provide the appropriate health care, the right nutrition, or even provide stimulative interactions needed to fulfill the development needs of their children and lay the foundation for children's overall growth and well-being. And that's where this government programs help and to ensure that people, informal workers and their families living in such remote areas are able to access these services. The third model that I'm talking about is we call them the smart centers. Through regular interactions with parents over the years, it was quite apparent that the education of the children is of prime importance to them. They really wanted their children to learn something. So the Smart Center builds on the approach of Seva's childcare centers that have been running for 4 decades by expanding creche facilities with an additional emphasis on pre-school education using new methods, tools, and activities. This is a pilot that to determine the potential of a worker-run center that is sustainable, and we take a higher fee from the parents here. That's how we are trying to make it sustainable. The facilities include larger activity area, guidance of a professional teacher, hot meals, as well as after-school coaching classes for older children up to 10 to 12 years old. and some digital learning tools are used so that the children can learn things through videos, through the television and other digital learning materials. For the informal workers, once they appreciated the value of the center, the higher fee was viewed as a worthwhile investment. This center provides a new means of childcare for the families who earlier depended on home-based care. The fourth model that we are trying out, these are, there are some women who want to keep their children closer to their homes in the same neighborhood with women they know and trust. This is the entrepreneurship model or the carepreneur model, and home-based centers we support, the SEWA supports these centers. We help them set up these centers. We help them buy the materials to set up. It's like a business that we set up for them. And the informal women workers run these centers from their homes with 10 to 15 children below 6 years of age. We provide the necessary training to them, and supportive supervision is provided, regular monitoring is done to ensure quality standards are adhered to. So these are centers that we are exploring in certain cities in India, and we are hoping that we would be able to develop a pool of care workers around in different neighborhoods and in rural areas and provide the necessary support to informal women workers and their families, particularly all the low-income families in India. The fifth model, and the last model, the cooperative, what we have seen over the years that the cooperative also needed to raise funds. We have been providing the services to our members in subsidized rates, and they do not cover the full cost. So we had to constantly raise funds. So the cooperative started partnering with other private and other sectors. So in partnership with the private sector, the cooperative provides employment opportunities for informal workers, and we have also started to set up childcare centers for the employees of the private sector, where we are able to provide employment and also generate revenue to help the cooperative run centers for the low-income families. So it's kind of cross-subsidizing, and these cross-subsidizing the worker-run cooperatives and the centers for the children of informal workers. So we have these 5 different models that we are trying, and we are trying to expand this and see what is working and what is not working, and how we can scale this up and how this can be replicated and in different settings, in different geographies, and for different trade groups and workers as per their needs. Thank you.
Thanks very much, Susan, also for speaking at a really nice pace and for keeping to time. I think this was brilliant in showing that there's not only one solution, but that you can try out different things and with that meet the needs of different constituencies. 2 things I wanted to pick up on that I really liked is that you don't only pilot your own models at SEWA, you also play a really important role in connecting families to other offers, right? Including the ICDS, which is a public service. So I thought that was interesting. And then the linkages you described between the different models, and especially the idea of finding different ways to make the whole system redistributive, to cross-subsidize through the partnership that you've made with companies in the private sector, the provision for the other groups. So thanks for that, and we look forward to hearing more in the Q&A about kind of the different models and how they compare to one another. For now, we'll move on to our next speaker, and that's Sneha Sharma. Sneha is a researcher and policy advocate with nearly a decade of experience in women's economic empowerment and youth development. She has worked as a consultant for WeGo's childcare initiatives, collaborating across Asia, Latin America, and Africa to strengthen WeGo's role in early childhood development and workers' rights. So Sneha will be presenting WeGo's recently published ebook that explores challenges, lessons, and promising practices of providing childcare for informal traders in market settings. So Sneha, over to you. You have 10 minutes.
Thank you so much, Silke, and hello, everyone. I work with WeGo, and I also had my colleague Tracy talk a little bit about WeGo. So our work has been with domestic workers, street vendors, waste pickers, and home-based workers. And this is what defines a strategy of engagement and how we implement, activities. So our work on childcare has actually emerged from the needs of the workers, and it was their demands. It has always been focused on improving the socioeconomic well-being of mothers and also the overall development of children. It is defined by innovation and its importance, but also how much it impacts women workers. So across 3 countries in Africa, South Africa, Ghana, and Rwanda, we have been working for over 5 years now, implement with the help of worker organizations and partners. We have now reached a point where we have some best practices to share, some key learnings, and even success stories. And based on that, we recently published an ebook which gives a story of how workers in the informal economy are now writing and influencing policies that guide childcare. And they are also ensuring how their voices are heard and their needs are addressed. And we are officially happy to launch this ebook today. You will have the links to this link to the ebook in the chats. So while I talked about that we have reached the stage, so there were a lot of challenges and lessons that have emerged during the whole period. One of the main challenges when we started working in the markets was that there was a lack of recognition of informal workers as users of childcare. So we have an ECD or a early childhood development cluster where we talk about the well-being of children, where we are talking about how the needs of children need to be met for their own potential. Then we have a gender equality cluster, which talks about women, but they talk about women as workers. But in both of these conversations, women informal workers as users continue to be missed. So that was one of the main reasons that we started this work. And this also forms the basis for the other challenges that follow. So one of them was the inappropriate legal frameworks or support from governments and lack of implementation wherever there were existing policies available. In most countries, policymakers have continued to neglect or haven't engaged with workers in, especially those in informal economy, and because of which the resultant policy have failed to take cognizance of their needs. As simple as having childcare guidelines which do not talk about childcare centers that can accommodate to the opening hour to the working hours of informal workers. So most of the childcare centers open at 8 a.m. and close at 5 p.m., which means it opens well after these informal workers have started their work and closes well before they are supposed to finish the work. And because of this, most of the informal workers rely on unregistered centers where there is no guarantee or there's no regulation on the quality, and it becomes such a slippery slope because it is not mandated for them to have any quality regulation. So there's a need to find a balance of how regulations can also meet the living realities of informal workers. Then, because they are in informal economy, these workers do not have any formal employer-employee relationship, so they do not have any work benefits, and they lack access to grants or maternity benefits, and they're often excluded from social insurance schemes and cannot afford to take time off work. So they continue to work and they continue to get their children to the markets, and they continue to do their caregiving responsibilities while they are also working. One of the major challenges was accessibility. So, despite seeing an increase in migration in urban centers in all the three countries that I mentioned, South Africa, Ghana, and Rwanda, and the complexities that this rapid urbanization is bringing, cities have failed to plan for that. Cities have failed to build childcare centers in low income neighborhoods or in densely populated trading spaces, and municipal bylaws provide little to no protection. So when even in cases where there are pre-primary education which is available, the working hours, the hours of those do not fit the ones for the working women. So that is also not suitable for them. Another challenge was affordability. So private services remain out of reach for these women workers. It's always really high for them to be able to access these. Even minimum fees actually becomes very difficult for these women workers. They work in really precarious situations. Their earnings are already low, and now with situations such as climate change, floods happening every other day, they continue to miss a lot of chunk of their work, and their earnings completely fall during that period of time. So they do not have any extra money to be able to spare for childcare centers. Another main reason for us to work within markets was we recognize that these are dangerous workspaces. Women are getting their children in such workplaces. They continue, the children continue to be there while women are working. So even women are not able to be vigilant all the time. There's amid the noise and the bustle of the stalls and streets, the children often wander off and get lost, and the traders also find it very difficult to care for them. So these were some of the challenges that we encountered during the time when we were implementing the childcare center in markets project. But there were also some opportunities that we saw. One of the main opportunities was for us was finding the right way of engagement with traders and also the government officials. While we talk about lack of political will, there is also a space for us as civil society organizations to find how well can we provide support and how well can we balance, um, create a balance between traders and the government. So one of the main approaches for us in any kind of work has been to begin with the traders, to hear from them. So in Ghana, when we started our work in Accra, we started discussions with local traders in the Makola market. There was also initial policy review, which highlighted that there were significant gaps, particularly the absence of a comprehensive need assessment that would address early childcare issues, especially for informal workers. So Ghana had a early childcare policy already in place, but that did not account for the needs of informal workers. And then they had mandated for 42 centers across the markets of Accra, but there was only one childcare center which was supported by the government, which was in the Makola market, which is their largest market. But the government was not working on that center. The center was completely shut, and it was the market traders who themselves started running this center to accommodate the needs for their own children. And now at that point, it reached a stage where the market traders didn't feel confident enough to let the local official come back and take it over because they felt that they do not understand the challenges and they would not be able to provide adequate service and provision. And that's where WeGo wanted to intervene. And they took it upon themselves to be the bridge between the local administration and the traders and get them together to collaborate. So for that, they decided that it would be a good space for us to, design guidelines that can support the proper running of this childcare center. Based with the help of the team and the collaborative efforts of the team there, where they engage with the government and also the local traders. They were able to develop a reference group with over 55 members, which included parents, which included informal traders, which included market leaders, market administration, and even the local government. They were able to design guidelines that would support this center. The guidelines had quality standards. The guideline also had accountability mechanism to hold everyone who is involved in the implementation of such a center, to hold them accountable. And because everyone was involved, they also created ownership for these kind of guidelines. So based on that, so ultimately now the childcare guidelines has been implemented and it is being piloted in the Makola Center, and that's has been a great opportunity for us. The other great opportunity that we saw was community-based solution. So our partners, SEA Etafilini, who are working in the Durban markets, were dealing with space constraint and affordability, and they were determined to use what was available in the markets and what was already being used by the traders. So they designed a crib, which now has been transformed into a care crate, and now it is being used into a whole early childhood development center. So these are two care crates that are designed from a storage box that the traders use themselves. So when these two care crates come together, they form a kitchen, a nappy change table, a toilet, and a sick bay. And now this has turned into a whole ECD center within a market in Durban, in the Warwick Junction. And it's also such a ingenious solution, because this can also be dismounted in a day. So even in case they, as a space constraint, they are able to dismount that. And at this point of time, this center is running oversubscribed with more than 12 children accessing it daily. And it's become such a happy place within a market for the children to access. So these are some of the opportunities that we saw. And yeah, so thanks.
Thanks so much, Sneha, for the great presentation, but also for the fantastic work on the ebook. I encourage everyone to follow the link and check it out. It's really, such good examples of, identifying childcare needs from the bottom up, and as Sneha also said, playing that bridging role between the needs of the workers and the policy frameworks, which often exist but are not really adapted to those needs. So thanks so much, Sneha. And we will move on now to our final presenter, Dr. George Evans Ovino. George works as the Program and Knowledge Management Lead at the African Early Childhood Network, based in Nairobi. And he will be sharing a presentation about balancing market-based approaches and public good models in childcare. Over to you, George. You have 10 minutes.
Thank you very much, Silke, and the previous speakers who have spoken before me. I take this opportunity to just welcome the colleagues online to just share what we're doing as the African Early Childhood Network. We are implementing an African Continental Childcare Campaign, having also components of National Childcare Dialogue. But just briefly about who the African Early Childhood Network is. The African Early Childhood Network is a continental ECD network that is based in Kenya and collaborates with other networks, including ECDAN, to advocate for early childhood development, to give voice to some of the issues that are being raised, the advocacy issues with regard to childcare, with a vision of an Africa where all children have access to quality early childhood development services to enable them grow, thrive, be safe, and thereby achieve their full potential. Currently privileged to coordinate the cluster, the ECD cluster at the African Union. And as a platform for advocacy, African seeks to help in realization of the rights of children. And childcare is one of the rights that is enshrined in the African Charter for the Rights and Welfare of Children. And so we think that childcare is something that we need to advocate about, bring actors together to talk about childcare, equitable, quality, affordable childcare for all children on the African continent. And so another way that we are trying to do this is through influencing of policy and practice, looking for gaps or opportunities in policy, regulations, and other guidelines that can ensure that then childcare is prioritized and also budgeted for, but also strengthening partnerships. And this is what all I'm going to talk about is about. How do we bring actors together? How do we create partnerships and those collaborations that will ensure that we raise the critical voice that elevates childcare to the national and continental platform, make policymakers understand the importance of childcare and therefore prioritize it, and also make it everyone's business. So some of the key initiatives that African is engaged in, through which we could leverage and bring childcare to the platform, is technical support for the integration of nurturing care to different kinds of governmental agencies, including the African Union, regional economic communities, and member states of the African Union and the regional economic communities. One example of what we've been able to achieve is the establishment of the Responsive Caregiving Committee within the context of the East, Central, and Southern Africa Health Community, which brings technical experts from the Ministry of Health together to talk about, responsive caregiving and plan for the same. Another way is to provide technical support to strengthen in-country multi-sectoral collaborations and coordination of ECD work, ECD actors. And this is we're doing this currently in Kenya, in Mozambique and Tanzania, supporting national governments, but also networks of early childhood development to bring other actors together to ensure that ECD is elevated to the national platform. Another way is through strengthening and formation of national ECD networks in countries, through capacity building, giving support, seed grants to register themselves, and also strengthening their capacity to govern themselves, supporting creation of boards of governors, board charters, and strategic plans. The other way that then we provide a platform for actors to collaborate, share knowledge, is through convening of high-level technical knowledge exchange and learning events. And something that comes to point quickly is the first African Early Childhood Network ECD conference, which was held in Nairobi in 2018, which has been followed by 2 regional conferences, one for Southern Africa, which was held in March in Lusaka last year, March 2023, but also this year with the Eastern Africa Regional Conference that was held in Dar es Salaam, where Sheikh Kufe mentioned they launched, so they shared the mapping with ECD actors on the continent. But also we collaborate with other actors, including UNICEF, World Health Organization, to develop a range of knowledge products. The recent one that you can talk about is the Compendium of African Initiatives to Support Parents and Caregivers of Adolescents and Young Children, which really was an outgrowth of a convening that was held in 2022 that brought actors to share their evidence-based, parental programs. A total number of 28 programs were shared, among others. So just to talk about what you're doing around childcare, I mentioned earlier that childcare is a right of young children that is enshrined in the African Charter for the Rights and Welfare of Children, of the child. So one thing that African is doing is bringing actors together to catalyze a national conversation in 5 countries to elevate childcare to the national platform, bring it in the forescreen of policymakers, but also everybody else that need to have an idea of the importance of childcare. This work is being done in 5 countries, in Ethiopia, in Kenya, in Tanzania, in Uganda, and in Zambia, and also involves development of landscape analysis on the status of childcare in these countries, so generating evidence to talk about the status of childcare, including identifying the childcare models in place, the actors in place, including women and economic empowerment organizations. And then out of this work that is being done in 5 countries, we are planning a regional childcare convening that will take place sometime early next year, so that the 5 countries and other countries that are not involved in the dialogues can come together, share learning and share experiences, and generate advocacy issues that then can be elevated to the continental platform. We are also working on designing a multi-country regional advisory team to advise on matters of childcare on the continent. How do we then design what we can call a continental childcare movement or program, leveraging all the best practices and models that are being showcased here, but also then bringing this to the level of policymakers. How do we convert this then to policy and programs? Just to share a few things that we need to look out, a few upcoming events that you may need to look out. We are having a national dialogue on childcare that is coming up in Zambia. That is on 31st of October, 2024. That is, I think, next week. So if you are around Zambia, if your organization works in Zambia, this is something to look out for. In Kenya, we are also having the dialogue coming up on the 14th of November. That is next month. So those actors that do something on childcare or ECD in Kenya, you're welcome to come on board. But also we are planning the regional conference that I talked about on childcare that's coming up early next year. As soon as we have firm ideas around the date and the venue, we will send a save the date to let you be informed of the same. But also we look forward to the national dialogue that will take place in Tanzania in March 2025. Once they also confirm the dates, we'll also make you aware of this. But you also talk about another opportunity. One of the major conferences that will be coming up next year in the third quarter of 2025 is the West African Regional ECD Conference. This will take place in the third quarter of 2025. We are yet to confirm firmly the venue. Currently, we are working with Senegal, but the dates and the venue, once confirmed, will make you aware. So these are some of the things you want to look out for. And I'm grateful for the opportunity to share with you what African is doing on childcare in the continent. Glad to answer any questions that you may have. And over to you, Silke. Thanks.
Thank you, George, for the presentation. I think what I found particularly interesting about what you shared is really this approach that combines both national level work and work at the regional level, and combines a range of strategies for that, going from kind of awareness raising and dialogue to advocacy, technical support, and research and evidence, which are all very important components. So thanks for sharing that. We will now move on to a bit more of an interactive part. I have some questions for you. I've also looked a little bit in the chat and in the Q&A segment to see what other participants here have raised. I would ask you maybe for this segment to all come on camera so that it feels a little bit more like a conversation. I also see 2 raised hands, and if people have more questions, please go ahead, put those in the Q&A segment, and we will try to pick them up. We have a half an hour, so hopefully we'll still get to some of those. So picking up also on what's been raised in the chat, Shekofe, I was wondering if you could say a little bit more about how the Childcare Systems Map can be used in practice to inform policy decisions and interventions, in particular in resource-poor settings. And related to that, there was also a question in the Q&A to say a little bit more about the levers of impact that can be identified. They are, of course, context-specific. The map is a tool, but if you could give some examples that kind of would bring those levers to light, I think that would be great. Over to you.
Sure. Thank you so much, Silke. So as I shared earlier, we haven't actually launched the map. And I'm wondering if it's okay if I can use my liberties as host. Rebecca, I don't want to put you on the spot, but it would be amazing to have you share, who's our colleague who's worked very closely with me on this from South Africa. And I think Rebecca has been using it a lot internally and with the South African government. And Rebecca, if you're there, I'd love to hear from you. But just to say very briefly, you know, we've used the map in many different ways, as I shared earlier. I think one is when you have the whole complex system in front of you in a physical way, and you have people from different stakeholder groups and so on, you start to see where different people's biases are. You start to see where we're kind of missing each other, and it allows us to develop a common language and a common understanding of the issue that normally, because of different sectors and languages, we come at it in different ways and we miss things. So in one way, that's been there. An example, we had a ecosystem workshop where we invited stakeholders across the childcare system in Bangladesh. And one of the things that the government representative who was present there said, we could really use this to develop our collective strategy and come back to the map year after year to see how have the dynamics changed. So you can actually see how different people intervening in different parts of the map can actually shift the dynamics of the system. So it can be a very interesting tool. But Rebecca, I see you're on and unmuted, so I would love to hear from you to share a little bit about the South African context.
Sure, and thanks so much, Shakufi, and it's great to be here. I guess we're at the start of this journey in terms of trying to apply it in the South African context. It's been fascinating being part of the co-creation of the map over the last 2 years. And what we're now looking at is how we can convene role players from across the country to, in a sense, validate it for the South African context, to amplify it, to play with it. And one thing that we're really interested in there is having all role players in the same conversation. I think that's what we've realized as we've worked on the map, is that where things go wrong is when sort of government officials just talk to the sector and then community consultations happen, but that you never end up government talking to parents, talking to ECD practitioners. And when those sorts of dialogues happen, you really see how people, just as Shakufa, you were saying, just how people are describing their bit of the big elephant, and nobody's seeing the whole. And you need everybody's descriptions of the elephant in order for us to accurately understand it. And I think one thing we'd say as we've been trying to apply it in the South African context is that we've had to sit with the complexity. And I'm sure that a few of you, when you saw it come up on the screen earlier, sort of had slight heart failure. And I know that when we started playing with it, we were like, oh my goodness, does it really need to be this complicated? And I think one of our learnings in South Africa is that when we are looking at systems change, we have to be comfortable in complexity. And it's when we move towards oversimplification that we actually we basically work at very low points of leverage within the system, and we don't recognize the high points of leverage, which are often more difficult, but often remain neglected. I think in terms of just identifying a couple of high points of leverage that this has brought home for us. The first is the critical importance, as some of the speakers today have been talking about, of contextually appropriate policies and financing systems. And we see that when they are not contextually appropriate, they have really serious ramifications for the early childhood development system, and they work against equity. They lock out the children and families that most need to be reached. But the second high point of leverage that we often sort of miss because we feel more comfortable talking about policy and government and all of that piece is the power of parental and community knowledge and understanding, and that as you build parents' knowledge of the importance of early childhood development, as you equip them to demand quality childcare and quality early childhood development, then the ability of those parents and communities at a local level to start shifting the system, to start shifting the patterns of supply and demand, if you like, is huge. And that we will only get so far if we come at it from the government end, that it's as important, if not more important, to empower parents.
Thank you, Rebecca, for coming in on that. I think it sounds like that policy mapping is a really effective strategy for, really getting everybody's inputs and voices heard. Susan, I wanted to come back to you as well. You may have seen that there are several questions for you in the Q&A as well. So I was wondering if you could pick up on those. There's a question around the effectiveness of the different models that SEWA has been piloting and trying out in different settings. Related to that, people have asked about the cost of these models, whether there are any evaluations, how government policy and regulation are involved in the functioning and so on. If I may also ask you to stick maybe to 3 to 5 minutes so that we can still open the floor to the by now 4 people who have their hands up, that would be great. But I know you have a lot of ground to cover given the questions that have already come through. Over to you.
Thank you, Silke. I did see the questions. So one, I would like to start by saying that there was a needs assessment done a couple of years back in 4 different states and 5 different districts to understand the needs of women workers. And what clearly came out was that there's a need to, build proper childcare arrangements either close to mother's work site or their homes. And they all preferred timings. The preferred timings for them depended on the nature of occupation. So different trade groups, different women, based on their work, they require different timings and different, different timings for their the centers. Also, the needs differed. Now, one of the questions is the cost of running these centers. So most of these centers that I talked about, they are low cost, not very, maintenance, the costs, the running costs are not very high, except for the smart centers where we are taking a higher fee. And, these are women, these are informal workers who send their children, are the ones who want education is a priority. So they want to pay that extra money to ensure that their children get the necessary school education to prepare them to go to school. So we have learned that it is important to, give them choices. So that's important. Give them options. So what is it that you can? It has to be accessible. We have to maintain quality standards. Standard operating procedures should be in place. It has to be accessible. It has to be somewhere where they can trust. Trust is an important factor that we have seen, and because SEWA has been around for 5 decades, so there is a trust, and they want to send their children to our centers. Now, so that it is important that different locations, different trade groups, where women are, where you are placing your center. So that's how it works. So it doesn't work. The same model perhaps would not work everywhere. So we need to, that is the reason you need to have explore different models. With respect to evaluations, we've done some. But within a year or 2, we are planning to do the evaluations of all the 5 centers, and I'm sure we will be organizing a webinar, and we will send it across at that point, and we will be organizing dissemination meetings and workshops at that point. But we definitely are planning to do that. And I already talked about the preference of informal workers. Government policies, government in India, the ICDS is the largest and the only ECD program that has this wide outreach and reaches across the country. They do not have full day, but the government has started working on it. And in some states, they have the ICDS as extended hours and full day hours. We've also worked in some centers where the extended hours were provided, and the community, the women, they were very happy to send their children full day. And government, they have their standard operating procedures. They have standardized it, and we are hoping in the next few years, this is an agenda that the government is talking about, and we are hoping that this is going to be an important point that we all will be discussing and participating in the coming years. Somebody had asked about the PRI involvement. Yes, in some states, the Panchayati Raj or the local government they have taken the initiative of running these centers at the local level. And we at SEWA, the way we work is that we mobilize our members to access the government services, and we work closely with the government frontline workers and ensure that the services reach our members and the members are able to access these services. So I would want to conclude by saying that we have to explore different models. One size doesn't fit all. It depends on the geographies, on the occupations of the women, what they need, what these families need, and we have to work around it. Thank you.
Thanks very much, Susan. I think you've also touched on one of the things that that kind of pops up in my head when I listen to you all. These are all such important experiences and exercises to make sure that you have not one size, but different options to serve diverse needs. But at the same time, when you then think about scale and really a national system, that creates a really high degree of fragmentation that in some way needs to then all be kind of pulled together. And what you said about the standardized procedures that you're developing with the government sounds like that could be a promising way forward. So I just wanted to throw that in as well as we move to Sneha and George, if you have thoughts on this issue about how, you know, we can ensure universality with the diversity of models of provision as we also think about scale. I think that would be great. But Sneha, I was wondering also if you could tell us a little bit more. You've talked about the challenges and opportunities associated with providing childcare in market settings already. So in the spirit of the conversation, could you talk a little bit more about how we can ensure that these models are sustainable in the long term and equitable for both the childcare providers and the families who use them?
Thanks, Silke, and it has been great listening to everyone. So during our experience, even when we were implementing the childcare center in Durban or in Ghana or in Rwanda, one of the major issues has been affordability. So, you know, ensuring sustainability, it is important to maintain that the fees is at least subsidized or covered, because that also impacts how we can maintain the decent work condition for workers if we are not able to pay for their salaries, and also the quality of childcare. So one of the main things that we have been trying to do is getting these models scaled up, or at least the guidelines be included in the government systems, even for the model in in Durban. We have been trying to engage with the government to at least ensure there is some subsidization coming from the governments. So public financing is the key for sustainability. But apart from that, there's also having worker-led decision-making structures. Like, how can we empower workers to be able to participate in policy reform processes? How can they advocate properly with the government systems that are already available? So it's not just, it's about giving them spaces, but also giving them enough information and training and capacity to be able to actually do that. So that's also been one of the major things that we are advocating for to ensure sustainability. The other thing is recognizing childcare as a right, because that is one of the major, you know, that would impact how the political will of a country towards how they view childcare. That changes. So getting that within the as a fundamental right and in the legislation would actually open up a lot of funding, a lot of you know, state acting as a regulator for most of these childcare centers that exist. So these were some of the things that we would, you know, would want to do in terms of ensuring sustainability. Of course, this is a longer way, since a lot of these are dependent on, you know, policy reforms and things like that. But these are some of the ways that we think we can have worker-friendly childcare services. It really doesn't depend on what kind of model, but these are some of the basics that we can have for different models and ensure that there is sustainability. So, you know, that's how we view as a worker-friendly childcare service to exist in a country.
Thanks, Nea, and yes, I think those are great strategies that WeGo develops in terms of, also what you mentioned previously, playing that bridging role, making sure that workers are empowered to claim the right to childcare and really mobilize around it. We have George up next. George, I was wondering if you could say a little bit more or elaborate a little bit on that process that you've highlighted in your presentation about the inclusion of diverse stakeholder perspectives and shaping, in particular, perhaps national conversations around childcare in the countries that that you're working in. And then I will try, after that, I will try and give the floor to the 4 speakers who have their hands raised. I'm trying to find out if we can open the mic for them, but hoping that will be possible. Over to you, George. You're on mute.
Sorry for that. Thank you very much for the wonderful conversation that we're having together. I think for me, how we work to ensure inclusion is this commitment to collaborations, commitment to partnerships, commitment to multi-sectoral collaboration and coordination, knowing that no one can do it by himself, no single organization can achieve it by himself or herself. But if we come together, we can achieve much for young children. And I think that the principle is that we need to center the child. So the child should be the focus, as Zelifa said. Even if you look at providing quality services, the child needs to always be at the center of our thinking, whether it is services provided in informal settlements, services provided in workspaces, service provided in agricultural settlements, or whatever setting it is, the child should be key. And therefore, even policymakers need to have this in mind. But quickly, to just answer the direct question that you asked, how do we ensure that we have a diverse team or include every voice that needs to be included? So one way is that the team that is driving the process in each country is made to be sufficiently diverse. It has a representation from civil society, from government, from academia, the media is represented. And we are ensuring that that core team tries to look for everyone that needs to come on board. We are talking about government, policymakers. We're talking about international organizations like UNICEF, Save the Children, and others. We're talking about civil society organizations. We're talking about academia. We're talking about childcare service providers. We're talking about caregivers, the people who give the care. They need to come and their voices need to be heard. We need to talk about women economic empowerment, organizations, as well as associations of domestic workers and any other person that needs to come on board. Even associations that provide training for childcare givers. So really what you're saying is we are rich in our diversity, bring everybody on board, and their useful perspectives would inform the debate and can be able to help us craft solutions that will ensure that whatever options we decide for, as depending on context, that option will resonate with will provide quality, will provide access to quality ECD services irrespective of the circumstance and the environment. Yeah, thank you very much.
Thank you, George. So we have 12 minutes, I can see, and we have several raised hands. So I will call on you in the order that you've raised your hands. We'll start with, and I'll just name all of the people who have requested the floor. Saju Saidad, then we have Nathan Tilahun Mulat, and then Paulette Bollers. I had seen Gabriela also with her raised hand, but it seems to be lowered now. So we can still figure that out. And others, please feel free to put final questions that you may have, final burning questions in the chat or in the Q&A. Once we've heard from the people who have questions now, and please keep your questions fairly brief so that we have actually time to go back to the speakers to answer them. I would like to give each of the speakers 1 or 2 minutes to respond. Thanks, and over to, I have now hands lowered. I don't know if Saju still wants to come on mic. If not, I can see a raised hand by Nathan. Is Nathan able to unmute?
Yes.
Yes.
Hi,
Okay.
hi everyone. Yeah, thank you very much. Thank you very much for the organizers, and Shekufe, thank you very much for the response. My question builds on the last issue that was raised, especially addressing diverse issues and at the same time trying to universalize. And my question goes to Susan.
Can you introduce yourself? Where are you calling from? Who are you? Yeah.
Okay. My name is Nathan. I am an early childhood development specialist based in Addis Ababa, working at Child Fund. My question goes to Susan. Looking at the first presentation by Shekufe and understanding the complexity of the overall childcare ecosystem, and how are you, dealing with overall policy level frameworks, not just at the national level, but also at the district level, in allowing, so to say, supervisors at the local level and understanding the complexities of dealing with different modalities of families and the needs of models, be it childcare at a home-based level, at a franchise level, workspace modalities, building the awareness of local supervisors, I believe is pretty important, and also understanding the complexities at the same time addressing quality concerns at these different modalities. Thank you very much. Over to you.
Thank you, Nathan, for the question. So there's a lot of capacity building and training of supervisors at a local level. We have intensive training for the creche workers, and even like for the franchisee model, it's the training. We provide the training. We help them set up the centers, and then they run the centers. But we are, constantly monitoring and supervising and reviewing and helping them maintain the standards, so that we have to do that. You can't just leave that. At the same time, for all the different models, we have different SOPs in place. And as you probably know, SEWA works. SEWA has a strong base at the community and the ground level. We have our frontline workers, we have our members. So that kind of support we get from the community. And our whatever we do, the knowledge comes from the community. So for example, the cooperative is run by the women themselves. So the ideas and the knowledge come from them. So that's the reason, that's how, organically many of these models emerged, because it came from the women. The franchisee model, I know many countries have that, but in our case, we actually saw one of our creche workers who retired. She started running these centers after she retired, and we saw her doing it so well and said, oh, that's a good idea. Why not we have women trained in different settings, create a pool of this skilled care workers, and have them all around in different communities, so that there is so the informal workers who need, they can always send their children to their neighbors and to their friends who are already trained. But we are now kind of formalizing them by registering them into the cooperative, and the cooperative does the monitoring and ensures standards. So that's how we work at the different levels. Because of a strong membership base, we are able to reach out to the district and the local community level. I hope I've answered your question.
Thanks, Susan.
Nathan?
We have 3 more hands raised. In the interest of time, I would suggest that we take the 3 questions one after the other, and then go back for a final round of wrap-up in response to those questions and any final words that the panelists and childcare experts would like to share with the audience. So I have, in order of appearance, Paulette Bollers, Rahab Wanjiro, and Iraguha Prisa. I hope I'm not very badly mispronouncing all of those names, but Paulette, you would be first. Let me it looks like Paulette has dropped from the call now, so let's maybe move on to Rahab.
Hi, It's been a pleasure being here today. I really enjoyed the conversation going. I'm Rehab from my company is called My House Help. So I have listened to a lot of the conversation
Where are you calling
happening.
from? Rahab, where are you calling from?
Nairobi, Nairobi, Kenya. Yes. So the conversation around childcare in this case has been mostly zeroing in to centers that we like, maybe what we would call like daycares in the country. But then where is the place of home-based childcare? Because it's very prevalent in country, like in I work in, very prevalent. And you'll find that only in emergency cases, you find people in their kids' centers. Yet we have very many women working in the home-based childcare kind of setup. And how can we improve how they deliver so that, because the children who are working under these women, and how do we work around that? Thank you.
That's a great question, Rahab. So I encourage all panelists to think about that. I think it's really relevant how to improve the home-based childcare arrangements. We have Ira Guha. And Ira Guha, if you're able to open your mic and could briefly introduce yourself to then.
Good afternoon, everyone. My name is Ragua Priska. I work at the Institute of Policy Analysis and Research, Rwanda, IPA. Thank you. We've been doing some project on ECD. I loved all. Thank you to the host and all the presenters. I think we have started. I managed to do some study in the 5 districts of the country on the ECDs, and they have challenges, much as we have gone some step, like we have home-based CDs, we have models, and then we have the pre-nursery ECDs. So like the women, we did 3 workshops on ECDs, and they were telling us their challenges. We were using a tree where we had the roots, the problem, and the solution. So the people were telling us, and as George, I think it's Susan who said it, I don't know who said it, but somebody mentioned like each society has its own challenges. Even these 5 districts where we did a study, they have their, depending on the location of the society, they have their different challenges. Whether home-based is where the neighbors bring their children, and then a volunteer offers to stay with them, and others go to do productive work. So I want to ask Susan, how do they manage? Like you see, like here we have a home-based ECD. Okay, we have home-based, we have center-based. Center-based, they're like models in the community. And then we have the pre-primary education ECD. So like for us, we are talking about where the challenges were at home-based. Since it's a voluntary, that's done on voluntary, how this question I'm basing it to Susan, how do you manage it in your country? The teachers don't have knowledge. Sometimes you find the environment is not friendly for the children, and then the requirements. How do you manage, much as there are policies the government is trying to put in some efforts? As you've said, UNICEF is also supporting, but still there's still some challenges. How do you manage it? Thank you.
Thank you, Iragwa, for that question. Another one related to home-based care arrangements and how to improve the quality. We're almost at time, but I did want to give a chance for kind of a rapid round of responses to the questions and concerns raised by everyone. There were a specific question, one more specific question for Susan, but I think others also have important things to contribute on on the question around home-based care possibly, or any concluding words. If you could each stick to 1 minute, that would be greatly appreciated. And I think we may want to start from the other way around, that we had the presentations. George, do you want to come in first?
Thank you very much, Silke. So on the question of home-based, how to improve home-based childcare, I think one of the things we need to talk about is supportive regulations and, mentoring, mentorship, close supervision by governments. Government could also think about subsidies to support the providers of home-based childcare services, but also training of domestic childcare workers and sensitizing parents on the importance of childcare, but also the need to, relate well with the trained caregivers. I think my parting shot would be that we need to look at childcare as a course that we need to defend and not as a project that we need to implement. Thank you very much.
Great, thank you, George. We'll move on to Sneha.
Thanks, Silke. And so on home-based childcare, we do have partners in Rwanda who have been engaging with the government, and now within Rwanda there are a lot of home-based childcare centers in and around Kigali city, and the government actually asked them for their support in training the workers, and even the workers who were using those childcare centers actually demanded for better training for the childcare workers, better support. So that's been one of the ways where we have been able to strengthen home-based childcare center. But another thing, as worker rights organization, it has been one of the priorities for us is to talk about the rights of those who are implementing these home-based childcare centers. They are often recognized as entrepreneurs in a social franchise model, but they do not have the same kind of collective bargaining power or the formalization that exists for maybe other kind of care workers, and they are often left out of any kind of conversation. They are just single entity units. So how do we include worker rights when we are talking about home-based childcare? That's also one of our focus towards strengthening home-based childcare. And other than that, of course, at the end, one of the main things for WeGo would be to strengthen how we recognize informal workers, both as users and also providers during these childcare centers. So that's like the overall vision for us.
Thanks, Neha. We're on to Susan now.
Okay, so the one point that, I've said a lot on this, but regulations and standards have to be set, and that's capacity building training of these workers or caregivers or creche workers who are running these centers. That's important. But the one point that I did not say, which works in our cooperative model and which we are trying everywhere where we work, is that ensuring that the parents committees are formed who actually monitor. So when the parents, you form small groups and they meet every month, they are able to monitor and ask questions because they want good quality for their children. So there are this local level, center level monitoring committees. Even in the government ICDS guidelines, they're supposed to have. In some places they have, some they don't, but that's a very important thing when the mothers and the fathers, they start asking questions when they are there. So they have to provide good services.
Thank you, Susan. Chikofe, over to you for final words before we wrap up.
I know we're over time. I think everyone has said everything. This has been an incredible panel. I think, for us, we are a global network. We care about early childhood and linking all the sectors together. And I think let's keep looking at the whole of the system. Let's look at how things are impacting each other so we can reduce the unintended consequences and try to ensure we're actually creating sustainable systems for young children that can benefit young children and their families everywhere. So really amazing, Silke. Thank you so much for this incredible moderation. You've been so good at highlighting the key points. So thank you so much.
Thank you, Shekofe, and thanks to all of you. I think this was a fantastic conversation. We've also had so many contributions in the chat. I hope we can kind of download and save that somewhere and go through it carefully. There's been so much information sharing going on. I've learned a lot from all of you. I've really enjoyed this. I wanted to thank WeGo and ECDAN for bringing us together and really, bringing all these diverse perspectives and encouraging us to think beyond our own silos about how childcare affects everyone. A special shout out also to Tracy Koske, who's really done such a wonderful job pulling all of this together. So yeah, thanks everyone, and I hope you go about inspired by this for the rest of your day. And looking forward to connecting soon. Bye.
Thank you and bye, everyone.
Bye. Thank you very much.
everyone. Bye.